Good afternoon. My name is Wally Curran. I'm the Executive Director of the Winship Cancer Institute of Emory University here in Atlanta, Georgia. The term dermatitis comes from the root derm, which refers to the skin, because you're familiar with the specialty known as dermatology. So radiation dermatitis is when there's a skin reaction from the delivery of radiation. It can be a mild redness, or it can be a more significant reaction. And like most reactions to any cancer therapy, this type of reaction can be graded from grade 1, 2, or 3. For certain types of cancers, it's necessary to get a high dose in the skin. That would, of course, apply to a tumor in the skin, a tumor coming from the skin, or a tumor that's just below the skin. One of the areas where we see radiation dermatitis probably at the highest level is in patients with cancers of the head and neck area, which could include the throat, the back of the throat or the pharynx, the oral cavity or the mouth, and other areas in the neck and face area. Sometimes those tissues, particularly the lymph nodes, are very close to the surface of the skin, so it's sometimes necessary to get a strong skin reaction in that area. When radiation and chemotherapy are given at the same time, the skin reaction of the dermatitis can be greater than when radiation is given alone. Now, many of the new radiation machines actually have what we call skin sparing techniques, where we can spare the skin much of a reaction. If radiation is being used to treat a deeper seated tumor, for example, a tumor in the pelvis, like a cancer in the cervix or a cancer in the prostate, radiation dermatitis is generally not much of a problem. Now, there are certain people who have greater sensitivity to radiation than others. It just can be personal quality, or it could be associated with a certain syndrome. So in that case, we do have to be particularly careful. The dermatitis can also result in hair loss or alopecia in a given area, and that can be a reaction that can be temporary, and after treatment, the hair will grow back. In the case of lung cancer, dermatitis is usually not a treatment-limiting problem. There can be dermatitis on a patient's skin, particularly when a patient receives treatment that comes from the front and the back, but generally it's fairly well tolerated. Treatment for radiation dermatitis can include certain creams, but I would advise any patient to really talk to their physician or their nurse about what to use. It's often advisable to go in with dry skin and without a cream before the radiation, because sometimes that cream can actually make the dermatitis worse.